Hi, everyone. This is Dr. Schatauer from the Green Medical Practice. And today we are having another conversation on I call it Green Medicine Conversations. And today I have a special guest, and I'm thrilled to have Dr. Barbie Allegretti with us today. I think you can all see her on camera. And Dr. Barbie is a doctor of chiropractic care, a chiropractic medicine, and she's been a chiropractor for 8 years. And she got her degree 8 years ago at National University in Lombard. And with that degree, she also has credentials in and has been certified in acupuncture. So she has a wide range of tools to use to keep everybody healthy. And her work right now is in several locations. She can actually see you from her own home via telemedicine. We all are getting used to that these days. And the other places she works, one is called Cornerstone, which is a clinic in Evanston, and it deals with chiropractic care. And the other, what I think is a very novel place is called Nourished. It's a location where she's the doctor of several nutritionists that teach people how to cook food that will make them healthy. And so she does the consulting for them if their clients need patient care. And so combining their expertise in nutrition and her awareness of things that are most important to make you healthy, I think that's a really creative way to put out our services and keep people healthy. It's not too common. You find a chiropractor in a nutrition center. Yourself, I'm curious. I've never really asked you, why did you become a chiropractor? What was it that drove you to think that it would be a great idea to what's your background in health and wellness?
Thanks, Dr. Paul. When I went back to school, I was out of school for a while after my undergrad, and I worked in corporate fitness. I was a trainer and worked in exercise. I worked for Blue Cross downtown, also teaching classes in Chicago, and decided to go back to school just to get more. I wanted to expand upon what I knew from a physical standpoint with exercise and impactive health, because there are a lot of clients who exercise is necessary and important. There's different ways of doing it, but it didn't solve everything for everyone. There were other areas that I wanted to explore and get more in depth on, whether it was from a physical standpoint or from a nutritional standpoint. So I went back to school for chiropractic, and that's where I also learned that within Illinois, chiropractors, our scope of care is primary care, short of prescriptions and pharmaceutical. So that's where I really dove into the functional medicine piece, more natural medicine, not just the musculoskeletal part from a chiropractic standpoint. And part of it was from my own experience and in supporting digestive and hormone related issues with nutrition and lifestyle. I was coming off of, I got married, started grad school for chiropractic, got married, continued grad school, 30 credit hours, and got pregnant during that time. So there was so much going on that,
I
was.
forgot to mention that credential you have of being a mother, not only of one, but two very beautiful children. In all of your experience that you've gained through your practice and through being a mother and raising a healthy family, what then is it, I think? Because we're in a time right now, it's winter time for one thing. So there's always this uptick of viruses and things that might get us sick because it's wintertime, and so we're really attuned right now because of the times that we're in, uh, of the threat of viruses, and it does get worrisome from the reports that we hear sometimes on on the radio and the news, we hear a lot of reports that kind of disturb us. And I always feel that when you have that fear, that all that actually feeds into a lowering of the immune system. And so here we are in the wintertime when our immune systems are challenged, and then we have this fear which challenges our immune systems. And it does become sort of this perfect sort of environment to get sick. And so the thing that I like to ask my guests when they come on, when they have some expertise, what do you do with your patients? And what are your maybe three main principles, or what is your expertise, or what do you offer that is kind of the pillar, the underpinning, the roots of what creates a healthy life, a healthy wellness, and feeling strong instead of feeling scared that you're vulnerable to some sort of virus.
Mhm. I always start with and then go back to just the basics. Um,
Mhm.
I start with, for people, whether it's an adult or either children, um, getting an idea of what their motivation is and their reason, and connecting with what's going to help drive them in making the changes or implementing, not necessarily habits, but more a way of life and a lifestyle that will sustain them. Nutrition,
Mhm.
nature, getting outside. And, regardless of weather, I've spent more time outside this winter than I think I have even when I was a kid.
Yeah.
Um, Nutrition, nature, sleep, and connection.
Wow.
Yeah.
That's those are some really strong. So let's break it down just a couple of a couple of sentences. What would you already said something about getting outside and nature. I
Mhm.
totally agree. I feel like I'm in my best at my best when I'm in nature. What about nutrition? What are some of the your principles in nutrition?
I usually start people on more of a anti-inflammatory approach to foods.
Mhm.
There's lots of different ways you could call it. You could call it a lot of different things. Um, I Whether it's anti-inflammatory or more of just a um, s- you know human appropriate, species appropriate, what have we been eating for
Mhm.
thousands of years that have really nourished us,
Yeah.
only been as late in the last 100 years or so that things have really, other than agricultural development, that things have really become so much more processed and manufactured and further
Mhm.
away from that original. So kind of getting back to that, returning to that, helping people to identify that, and
Mhm.
but also maintaining a realistic attitude and approach with it. There's a lot of options and many things that, doesn't mean ideally we would have the skills to cook the majority of our meals at home with local whole food ingredients. Um, that's not always the case all of the time. So having alternative options that are going to be good for that. So like you mentioned with Nourished, here, so they have a kitchen market. So they have, homemade soups where they do their own like bone broths, and I mean, all these great different soups and, smoothies, salads.
Wow.
Really, I'm like much better than I would do on my own cooking. It's so good. It always smells so good in here.
We need that support, I think,
Yeah.
sometimes. I mean, even us, we're supposed to be the best at what we do, right? Because we preach it all the time to our patients. But I find that when I'm around others that are eating the best, with the fresh foods and the fresh produce, and we're always talking about plant strong, so
Mhm.
that and I don't have any judgments against meat eaters or vegetarians, but I think both can exist, depending on your individual beliefs and tendencies.
Yeah.
But to actually be inspired by others is so important, I think, and that's that togetherness that we need. You're fortunate to be in that space where it's kind of in your face, and then it's hard to go to McDonald's after you've been at work when you do that, right? And that maybe leads to the next one of your pillars is connection. Can you talk a little bit about that?
I've been thinking about that a lot more, especially in the last year too, where things have kind of gone more remote and um, just ways that we can connect. For me personally, that's like a huge part of my spiritual connection is being with others. Um,
Mhm.
and so whether that's, within ourselves, within our family, within our community, finding ways to do that, um, has been a little bit more of a challenge this past year, but I think it's doable. I think also identifying, kind of recognizing where it can be a problem with more being consumed from technology or by technology than it is um, beneficial in fostering connection. I think
Yeah.
I've been thinking about that a lot is like, I love the phrase, technology is our servant, not as our master. And
Oh, wow.
yeah, it's that Weston A. Price, I think.
I find I crave connection. I mean, I want to connect with people because it is so enlivening and inspiring and nourishing and empowering. Uh, and there is some magic to it, I think. I mean, magic is a funny word, but there's some mystery, I guess, to being with people of like mind, like family, community, working on something bigger than yourself and feeling that connection between us um, really is one of the greatest signs of health. I
Mhm.
think in a patient, if they feel or the empowerment of a person in their health realm, if they feel connected to patients, if I feel connected to patients, if I feel connected to my family, if I feel connected, and in turn invite that connection
Mhm.
back, there is something that happens that is so motivating to me as a doctor. The next thing I say, well, maybe you should increase your exercise a little bit. If I have that connection already set up with that patient, they're all over it. Whereas if I come in with a script and this is what I want you to do over without the connection, I don't feel it's as effective. And
Yeah.
that and it's a win-win because I go home so full of energy when I have connections. And like you say, there are days when something's off and
Yeah.
I don't feel it as much and I'm not as effective as a practitioner either. That's what's so fun about our job, isn't it? That we have this opportunity to not only nourish our patients, but nourish ourselves with our work.
Right. Oh gosh, yeah. It's so, like I said, it's so fulfilling to me, um, and especially I think with how we practice, being able to spend the time to get to know people and uh, really learn about them, have that relationship. It's
Mhm.
yeah, I love it.
It's a whole different way of doing medicine, isn't it?
Yeah,
And I think if you tease out the like I said, the principles that really make a difference, these are the things that you cannot do without. Now, I'm not saying, if I need a surgeon, I worship the ground that surgeons walk on.
yeah,
And but I think our role as primary, and this is our role as primary care doctors, and you're a shining example of this. And I just want to, you know, support any kind of work you're doing. I'd love to learn more about Nourished and seeing what kinds of services I have to get out there. Where is Nourished? Where is it located?
we're in Hinsdale.
In
Yeah,
Hinsdale.
well,
Yeah.
maybe 30, not even 30 minutes from you. Next time I bring the kids in, I'll bring you some soups too.
Oh, there you go. That sounds great. Can you describe the what the facility is kind of like?
Yeah, that's important because it's very cute. It's in a residential neighborhood, so it looks like it's a house. It's an old farmhouse that they restored.
Mhm.
But it has the sign and everything out front. Not far from the downtown. It's just west of the downtown. by the train tracks off Vine Street. So I practice out of there so people can find me there on their site, but also I'm still private practice. So I have my own site, drbarbie.com as well.
Dr. Barbie.
So yeah, it's really a great collaboration.
Thank you so much for joining me today in this conversation, because it's an ongoing conversation and I hope it's not the last, because as time goes on, there's always new things to talk about. But be sure to look Dr. Barbie up online and you can take advantage of all the skills she has. And thank you for adding to what I hope to just keep adding more and more ideas on how we can stay healthy and well and feeling empowered and living the life that we all dream of. So thanks again for your time.
Yeah, thanks, Dr. Paul. I appreciate it.
All right, you take care today.
All right, you as
All right.
well.
See you later. Bye-bye.